On behalf of Midmark, welcome to the clinical instruction training video for the IQholter. Holter monitoring is a non-invasive, continuous monitoring of heart rate and rhythm during normal daily activities, usually for a 24-hour period. A Holter monitor is used to identify heart rhythm disturbances, which may come and go at various times throughout the day or night. It is often used to correlate any abnormal heart rhythms with a person's symptoms, such as dizziness, palpitations, shortness of breath, and chest or arm pain. The Holter monitor can also evaluate if a pacemaker is functioning properly. A Holter monitor may detect a disturbance in heart rhythm that could be missed in a standard EKG test. The IQholter system provides a compact digital recorder with 3 powerful software applications providing the complete information and analysis you require. This tutorial is intended as an overview of the IQholter and will guide you through the setup, preparation of your patient, performing the test, as well as editing results. In this video, the IQholter is being operated with the IQ Manager software. For EHR/EMR customers, please contact Midmark Support Services at 1-800-624-8950 option 2 for any additional instruction you may need. To begin, we will review the package contents and setup of the IQholter. The IQholter system comes with a compact flashcard reader with cable, a USB version software security key, 4 prep kits, a quick reference guide, operation manual CD, Holter recorder, and patient cable. You can now attach the patient cable to the recorder. Care should be taken when lining the pins of the recorder up with the patient cable. Next will be an overview of the proper patient preparation and electrode placement for the test. It is suggested that you have all items needed for patient preparation set out and easily accessible. The Midmark Prep Kit comes with the following items for correct patient preparation: 1 disposable razor, 1 abrasive pad, 2 alcohol pads, 5 electrodes, 2 AA batteries, and 1 patient diary. It is very important that you explain to your patient that all preparation steps, including shaving of hair, skin exfoliation, and cleansing the sites with alcohol, must be done. Proper preparation will assure optimal resistance between the skin and the electrode, and optimal resistance is necessary for good test results. To prepare your patient for Holter monitoring, they must be undressed from the waist up and sitting or standing upright. For female patients, ask them to remove their bra and wear an exam gown so that it opens from the front. Prior to electrode placement, have the patient remove their cell phone from the preparation area. Have the patient remove any heavy jewelry. The following instructions should be used when preparing a patient for a Holter test. Always shave the electrode sites if there is any body hair present. Next, take the abrasive pad from the prep kit and exfoliate the skin of each electrode site until the skin appears abraded and dry. Cleanse the electrode sites with the included alcohol pads. Before applying the electrodes, make sure that the prepped area is completely dry. The electrodes need to stay in place on the patient for at least 24 hours. Following these preparation steps will help ensure that the electrodes will remain intact and that a good signal is maintained. Now you are ready to place the electrodes on the patient. If you are not wearing gloves during the placement procedure, try not to touch the adhesive backing of the electrode, as the oils from your skin could reduce the electrode's ability to adhere properly. This diagram illustrates the typical electrode placement for Holter monitoring. This is a 5-lead 3-channel hookup. If there is deviation from this placement, please make note of it. Once you have placed the electrode, trace the outline of the electrode with your finger, making sure that the gel in the center of each electrode maintains contact with the skin surface. Also, make sure when placing the electrode that it does not wrinkle. Avoid pressing on the center of the electrode, as that may disrupt the gel and impede the conduction of the electrical impulses. Once all electrodes have been put in place, you are now ready to attach the patient cable wires to the electrodes. To avoid too much pressure being placed on the center of the electrode, the patient cable wires can be attached to the electrode prior to placement. Attach the patient cable wires to the electrodes according to the color coding indicated on the diagram of the IQholter Quick Reference Guide. Here are some tips for optimal electrode hookup. It does not matter which way the electrode is pointing. Each electrode has a small slit on the bottom left side of the electrode to allow you to create a stress loop. Adding the stress loop at each site will lessen the chance of the wire disconnecting from the electrode due to movement and reduces artifact if the leads are pulled or tugged during normal patient activity. Next are the steps to follow to set up the IQholter recorder. Hold the Holter recorder, turn it over, and carefully remove the battery door. Make sure the SD card is in place. When the SD card is in place, insert a new battery. Once the battery is in place, replace the battery door. Once the new battery is in place, the recorder will beep once and the display will light up. Please note that batteries used in the recorders are single-use only. Always use a new AA battery for each patient test. Now, press the down arrow to scroll to check and/or change the time and date. Press Enter, the center button, to go to the change screen. Use the up and down arrows to scroll through the numbers and enter the correct time and date. Use the right and left arrows to move between fields. Press the center button to save changes and return to the main screen. It is important to verify that you have a good signal coming from the electrodes to the recorder before your patient leaves the office. To check the EKG signal, press the center button and the 3 channels will be displayed on the screen. Press the down arrow to rotate through the individual channels. If one or more channels have low amplitude, excessive artifact, or a wandering baseline, check all electrodes and replace any electrodes as needed. The recorder will automatically start recording in approximately 8 minutes. The recording mode can be started immediately by pressing and holding the Event button, which is the center button, for 5 seconds, or until the EKG display turns off. The IQholter recorder will automatically enter the recording start time and date. Have the patient clip the recorder on their belt or waistband. A disposable Holter pouch is also available that will hold the recorder. Have the patient route and secure any excess patient cable before leaving the office. A patient activity diary comes in each Midmark prep kit and is an important part of the Holter testing procedure. On the front of the diary, write your patient's name or identification number, the date and time you started the Holter recording, and the recorder serial number. On the front of the recorder, there is a large button surrounded by directional arrows. Instruct the patient to push any of these buttons if an event occurs. Symptoms that would be considered an event and should be noted by a button push on the recorder may include dizziness, shortness of breath, chest or arm pain, and tightening of the chest. As part of the event, the patient needs to write in the patient diary the time an event takes place, the activity they're involved in at the time of the event, and the symptoms experienced when the event is noted. Be sure to instruct your patients on the importance of the Event button, filling out the patient activity diary, not pressing any buttons on the recorder unless they have experienced an event, and not removing the cables or battery during the testing period. Before the patient leaves the office, instruct them that the recorder, wires, and electrodes should never get wet. Showering, bathing, and swimming should not take place while wearing the Holter recorder. The recorder automatically terminates each recording after 24 hours. For early termination of the recording, remove the battery and SD card. A loss of up to 6 minutes of data is normal if the recording is terminated early. When the patient returns after the 24-hour recording period, ask the patient for the patient activity diary. Next, ask them to undress from the waist up and to sit upright or stand for the Holter removal procedure. While the recorder cables are still hooked up to the patient, hold the recorder, turn it over, and carefully remove the battery door. Remove the battery from the device and then remove the SD card from the recorder. Never remove and then reinsert the battery into the recorder while the SD card is still inside, as it will erase all the patient data. Next, remove the patient cable from the electrodes and carefully remove the electrodes from your patient. This portion of the tutorial will cover downloading, analyzing, and editing a Holter scan. Because of the extensive list of Holter features and the flexibility of the program, not every function is described in the tutorial. For an in-depth explanation of the features and functionalities of the IQholter, please refer to your operation manual or the help menu of the software. To begin, connect the card reader to the computer. Insert the secure digital SD card into the card reader to acquire and analyze the data. Next, open the IQ Manager software program. If you are analyzing a Holter scan for a new patient, you will need to click on the New Patient button and enter the required data. If this is an established patient, click on the patient list and search for the correct patient name or ID number. Click on the patient name and you will now be in the patient data screen. Click on the New Test button and select Test Type, Holter. Enter the technician's name, the name of the physician that ordered the test, and click OK. When the Holter analysis box appears, verify the recording time and date of the Holter scan. Time is displayed in a 24-hour format. For example, 1:00 p.m. is entered as 1300. Next, place a check mark in the Print Reports After Analysis box if you want to print a preliminary report. In the Holter Analysis dialog box, click on the Acquire and Analyze button. You have now completed the Holter download for your patient. IQ Manager automatically saves the patient information, the Holter analysis results, and the full disclosure on your computer and returns you to the analysis results screen. You can now remove the SD card from the card reader and store it with the IQholter recorder for the next patient. It is not necessary to reformat the SD card, as it will automatically reformat when you insert it into the recorder with a new battery. If the Print Reports After Analysis box is not checked when you click on the Acquire and Analyze button, the software will take you directly to the Analysis Reports screen. If the Print Reports After Analysis box is checked when you click on the Acquire and Analyze screen, the software will display the Reports screen. In the Reports screen, click on the Edit button to go to the Analysis Report screen. To view or change the analysis criteria while in the Holter analysis box, click on the Analysis Settings button. You can change any of the criteria in Analysis Settings to better fit your needs. The default setting has all 3 channels selected, and Channel 1 is the primary channel. Please note that atrial fibrillation AFib analysis is only available with the IQholter EX and IQholter EP. If the patient has pushed the event button on the recorder during monitoring, the Holter software automatically tabulates each event as a recorder event. In the Analysis Results screen, click on the Data Review button and then click on the Patient Events Diary tab to enter this data. You can now enter the patient diary information in this screen. Once the information is entered, click on the Save button. Please note that patient events are automatically read for the recorder unless the event button was not pushed. In the Analysis Results screen, click on the Interpretation Comments tab at the top of the page to view the overall narrative report. In the Narrative Comments screen, the physician can type in the interpretive report. Click on the Data Review button to edit the report. The Reject Current Strip button is only available when high heart rate, low heart rate, and ST segment categories are chosen. Use this button to quickly reject the current strip if it is incorrectly classified. Use the arrow buttons on the screen to move your view from strip to strip within the selected category. Clicking on the Add Comments button allows you to select or add comments to the bottom center of the EKG strip. Specific arrhythmia events are displayed in different colors. For more detailed information, refer to Section 3D, Reviewing and Editing Holter Test in the Operations Manual, or click on the Help button at the bottom of the screen. There are 6 tabs located at the top of the Data Review screen. On the Sample Strips tab, you can choose the category that you want to reclassify, then move the cursor to the strip that you have chosen from the category list, and right-click to reclassify any beat in the 8-second strip. Double-clicking the QRS complex of the beat is another way to reclassify any beat. The Beat Activity dialog box enables you to reclassify the beat to VE, SVE, Pause, Normal, or Artifact. The entire Holter report is updated automatically. Click on the Page Scan tab to review minute by minute of the EKG. Right-click to begin or end group. Page Scan enables you to review the full disclosure of the Holter recording. Click on the Heart Rate tab to view maximum, minimum, and average heart rate. Click on the RR Interval Ratio tab to view the R-to-R intervals and ratio distribution graphs. Click on the Events Distribution tab to view hourly distribution of arrhythmia events in bar graph form. At the bottom of the screen, click on the ST button. The ST Trend tab will provide the slope, level, and average heart rate. Click on the ST Tabular tab to view 24-hour tabulation. Template, STQT, and HRV features are only available with IQholter EX and/or EP. Click on the Summary button at the bottom of the page, and then click on the Narrative Comments tab. This allows the physician to type in the interpretive report. Interpretations entered in the top box also appear in the Interpretation section at the bottom of the Analysis Summary tab. Please note that any changes you make in the Analysis Results screen are saved automatically when you exit the screen. If you perform reanalysis of the current Holter test, any changes you have made in this screen will be lost. Click on the Settings button and then the Reports tab to select or clear any reports to be printed. Click OK, and any selected reports will be printed. Once you have completed and reviewed the Holter test, click on the Exit button to return to the Report Review screen. The physician can now enter their name in the Reviewed By box. The review date is entered automatically when you exit and save your changes to the report. Help buttons are available in all screens to assist you. Just click on the Help button to access information about the screen you are in. This concludes the IQholter clinical instruction video. For detailed information about this product and its use, please refer to the IQholter Operations Manual or contact us at 1-800-624-8950, option 2. On behalf of Midmark, we would like to thank you for your participation in this clinical instruction training video. Midmark would like to thank the Cooper Clinic at Craig Ranch for the use of their state-of-the-art facilities during the filming of this video.